Yep, so my day-to-day job, I'm one of the team physicians at The Ohio State University taking care of Division I athletes. So that gives me a whole different perspective of taking some of these athletes that will be in the NFL, the WNBA, or the next, we even have some Olympic athletes. So taking care of those athletes is kind of similar to soldiers in a sense that they want to get back to duty or back to sport as soon as possible. So we treat them very similar. We use the latest, greatest technology, the best that we have. And then after surgery, we also put them into physical therapy pretty quick. And here at Irwin, we have great physical therapists. We have blood flow restriction therapy. We have some of the high-tech tools to help get our soldiers back, the same as we do at Ohio State.
So what we have, this is a 1.9 millimeter arthroscope. The tip is actually an LED chip on a stick. So tip on a chip technology allows the camera to be very flexible and not damage the cartilage or injury inside. And it still works and maintains a high definition picture inside the ankle.
I stick around the Army because I love it. It's part of who I am. It's part of my identity. Like you said, I could easily retire. I got my letter, I got my time in, I have a good job. But coming back and be able to serve the best fighting force in the world is something that I love. So it's my opportunity to come back, continue to give back to the soldiers in the country, and I just love it. The injury is ankle instability. So in the United States military, we have 5 times the risk of having a traumatic ankle injury compared to our civilian counterparts because we're wearing gear, we're on rough terrain. So that 5 times the risk. And then 70% of those patients will go on to do fine, but 30% don't. So in the military, we have a very high rate of ankle instability. So the surgery we did today, we actually put a camera on his ankle and identified this young soldier actually had a crack in his cartilage and floating around in his ankle. So we actually removed the loose cartilage, treated the crack in the cartilage, and then actually repaired those ligaments, hopefully stopping his risk of instability and actually giving the soldier a very good outcome. And it's going to allow him to really avoid post-traumatic ankle arthritis and really get back to duty fast.
Even the bandage, these little dots on here, they're actually silver, so it creates an electrical charge underneath the surface to help prevent bacteria growth underneath the bandage even. So like every little step, it seems like one more little thing, but every little step we have thought out to the nth degree.
The standard that I provide at Ohio State is no different than the standard I provide here on base. Our soldiers have cutting edge supplies. This week we use some of the cutting edge cartilage that's actually a live cartilage, that we actually put live cartilage inside a soldier's ankle, and that cartilage will start to grow and form and to patch that cartilage, and that's the best anywhere. The same thing I would use at our Ohio State Buckeyes. Today we utilized a camera that's 2 millimeters in size, so I could sneak the camera inside his ankle without having to do any additional surgeries or any additional cuts to the bone or to his legs. We did a very complex surgery through 2 teeny incisions, and I would say right now that we're on the standard of anywhere in the country. I think when I as a soldier talk to either one of them, I want to talk to them and treat them the exact same. Whether the person's in the WNBA and I'm trying to keep up with their Instagram and watch their performance and thinking, yes, that celebrity just shot that 3-pointer and they won the WNBA. That makes me feel good inside, right? Or I see them playing on Sunday in the NFL. But honestly, seeing that soldier get back to duty that needs to pass his PT test, that needs to feed his family, it needs to deploy for the country. I mean, that to me is almost more heartwarming, gives me goosebumps just thinking about it. Getting soldiers back to duty is actually so much more important to the country and to what I do.